The respiratory and circulatory systems of racing pigeons are finely tuned to meet the extreme physiological demands of flight. As pigeons fly at high speeds for prolonged periods, their oxygen consumption can increase up to 15 times normal levels during training flights, and up to 30 times when flying into headwinds. To handle these heightened energy requirements and sustain stellar race performances, maintaining excellent respiratory and cardiovascular health is paramount. The avian respiratory system possesses several adaptations that enable the incredible athletic feats of racing pigeons. Their lungs are small and rigid compared to mammals, preventing collapse during respiration. Air flows in a unidirectional loop through the lungs during both inhalation and exhalation, ensuring efficient oxygen extraction. This continuous flow of air enables pigeons to remove oxygen from inhaled air on the first pass through the lungs, as well as extract more oxygen from air exiting the lungs. Pigeons also utilize 9 air sacs connected to the lungs to further enhance respiration. These air sacs function as bellows, moving air through the lungs and bloodstream. One pair receives air from the lungs on exhalation, storing it briefly before propelling the air back into the lungs on the next inhalation. This recycling enables pigeons to extract the maximum amount of oxygen from each breath. The air sacs also facilitate continuous, unidirectional airflow through the lungs as their contractions and relaxations complement each other. In addition to their unique lung anatomy, racing pigeons possess a remarkably efficient respiratory rhythm. Their breathing is synchronized with the flapping of their wings, taking one breath for every wing beat during flight. This coordination ensures oxygen supply meets the demands of flight muscle contractions. Pigeons generally take around 80 breaths per minute while perched, increasing to around 180 breaths per minute during active flight. The cardiovascular system of racing pigeons is also adapted to meet the intense metabolic demands of flight. Pigeons have proportionally larger hearts than similar-sized mammals. Their hearts make up an impressive 1 to 2% of total body mass, enabling high cardiac outputs. During flight, heart rates can reach up to 600 beats per minute, compared to around 100 beats per minute at rest. The avian circulatory system also utilizes countercurrent blood flow between the veins and arteries in the legs and wings. This countercurrent design maximizes oxygen extraction from blood by maintaining a concentration gradient that enables continued diffusion of oxygen from the arteries into the veins. This allows arterial blood to maintain high oxygen levels to perfuse the working flight muscles. Given their augmented respiratory and cardiovascular systems, maintaining optimal health is essential for racing pigeons to perform at their peak. Respiratory infections, heart conditions, and other circulatory issues can severely impact oxygen delivery and waste elimination. Even minor respiratory irritation or inflammation can impair sports performance. One of the most common and detrimental respiratory infections in racing pigeons is chlamydiosis, caused by the bacterium Chlamydophilus psittaci. This contagious pathogen infects the sinuses, nasal passages, trachea, lungs, and air sacs. Infected birds develop sinusitis, conjunctivitis, and rhinitis, causing nasal discharge, sneezing, and difficult breathing. Chlamydophila can spread rapidly through a loft, causing lethargy, poor performance, and increased mortality. Prompt treatment with appropriate antibiotics like doxycycline is required to resolve infections. Strict biosecurity measures are necessary to prevent introduction from wild birds. Paramyxovirus infections are another major threat, especially virulent strains like pigeon paramyxovirus type 1. This virus spreads easily through direct contact and airborne transmission between pigeons. It replicates rapidly, destroying respiratory epithelium and impairing mucociliary clearance. Infected birds develop purulent nasal and ocular discharge, sneezing, coughing, and severe respiratory distress. Mortality rates often exceed 50% in racing lofts. Supportive care and prevention through vaccination are the mainstays of control. Bacterial infections can also wreak havoc on the upper respiratory tract of racing pigeons. Common culprits include Pasteurella, Klebsiella, Pseudomonas, and Escherichia coli. These organisms opportunistically infect the nasal passages, trachea, and air sacs, especially birds under stress. Symptoms include noisy breathing, discharge, reduced appetite, lethargy, and poor performance. Appropriate antibiotic therapy is required for treatment, along with addressing predisposing factors like overcrowding, poor ventilation, and stress. Inflammation of the throat region can also impact respiration. The choanal cleft where air enters the throat should have a hairline parting and pink coloration. Excessive widening or inflammation indicates upper respiratory issues. Throat curtain should also show no overt redness or lesions. Stress can cause temporary horizontal wrinkling of the curtains which smooth out when the bird relaxes. Severe irritation signals underlying infection or conjunctivitis. The ears and surrounding head regions must also be evaluated, as the eustachian tubes connect the throat to the inner ears. Ear inflammation, excess earwax, or nasal discharge can indicate upper respiratory tract infections that require antibiotic therapy to resolve. The nostrils should appear clean, open, and free of discharge or scabbing. Eyes should be clear and bright without weeping or swelling. Any abnormalities warrant further diagnostics and treatment. Heart conditions can also profoundly impact sports performance in racing pigeons. One of the most common is atherosclerosis, the buildup of fatty plaques within arteries. This impedes blood flow to the heart and tissues, reducing oxygen supply. Affected pigeons become easily winded and fatigued prematurely during training and racing. Sudden death can occur in severe cases due to complete blockade of blood flow. Minimizing atherosclerosis through proper diet, supplementation, and medication is key for maintaining cardiovascular function. Bacterial infections are another common cause of heart disease in racing pigeons. Chlamydophilus psittaci, Mycoplasma gallisepticum, Staphylococcus aureus, and Streptococcus species can all spread to the pericardium and myocardium. This causes pericarditis and valvular vegetative endocarditis. Infected birds develop arrhythmias, labored breathing, lethargy, weight loss, and congestive heart failure. High mortality is seen if infections are not treated aggressively with appropriate antibiotics. Prevention through biosecurity and vaccination is ideal. Parasites like hairworms, gapeworms, and capillaria can also infect the cardiovascular system. Heavy burdens cause inflammation, impair blood flow, damage valves, and potentially obstruct vessels. Mild infections cause lethargy, weakness, and exercise intolerance. Severe cases lead to sudden collapse and death during training or races if large numbers of worms embolize to the heart and lungs. Regular deworming and loft sanitation helps limit parasite burdens. Metabolic disorders like hypoglycemia, dehydration, electrolyte imbalances, and nutritional deficiencies can also impact performance. Pigeons burning fat stores for energy during long flights can become hypoglycemic if reserves are depleted. Signs like muscle tremors, lethargy, and incoordination point to crashed blood sugar levels. Providing high-quality feed and energy supplements pre- and post-flight helps maintain glycogen stores. Dehydration during long-endurance flights, especially in hot weather, negatively affects all body systems. Pigeons can lose significant water through respiration. Dehydration thickens blood, raises heart rates, causes muscle fatigue, and hinders respiration. Ensuring clean drinking water is available along the race route is vital. Providing hydrating supplements pre- and post-flight helps birds recover. Electrolyte supplements can help replace salts lost through panting. Nutritional deficiencies, inappropriate diet, and poor gut health can all negatively impact performance. Diet should have appropriate carbohydrate, protein, fat, vitamin, and mineral content. Grit for digestion, probiotics for optimal gut flora, and immunity-boosting supplements are beneficial. Routine fecal testing helps assess gut health and identify parasitic infections requiring treatment. In addition to physical health, the training and handling of racing pigeons impacts aerobic conditioning and stamina. Following an established, progressive training schedule prepares birds physically and mentally for the demands of competition. Providing adequate rest and recovery between intensive flights is also key. Young birds should be exercised prudently to avoid overexertion and injury. Smooth releases and trap training accustoms pigeons to race conditions. Minimizing transport stress through proper crating and smooth driving helps birds conserve energy for races. Release point selection, race course terrain, and weather conditions also significantly influence race outcomes. Careful race planning improves performance. To summarize, the incredible physiological adaptations of pigeons enable remarkable feats of high-speed, long-distance flight. The avian respiratory system provides unidirectional flow through rigid lungs paired with expansive air sacs for maximal oxygen utilization. Their cardiovascular system delivers oxygen at high volumes through enlarged hearts and an efficient vasculature design. Maintaining the exquisite health of these systems through proactive care, prompt treatment of disease, strategic nutrition and training allows pigeons to excel in the sport of racing. Careful breeding and selection also perpetuates optimal structural and functional traits for success. By supporting both nature and nurture, racing pigeon respiratory and circulatory prowess can shine through as these birds achieve athletic performances rivaling the greatest human competitors.